The topic that I had was normal labor and delivery. Normal labor begins within 2 weeks, either before or after the estimated delivery date. Usually a woman who has their first pregnancy, the labor usually lasts about 12 to 18 hours. If this is not their first pregnancy, labor usually lasts shorter, on average about 6 to 8 hours. Delivery is referred to as the second stage of childbirth. There are 5 factors that define the labor and birth process. The first factor is passenger, that consists of the fetus and placenta. The second factor is the passageway, which is the birth canal. The third factor is powers, which are the contractions. The fourth factor is the position, to try and increase their comfort, promote circulation, and relieve fatigue. And the fifth factor is psychological response. Stress, tension, and anxiety can affect the progress of labor. True labor are the contractions that are strong, regular, that increase rapidly, producing cervical effacement and dilation. Contractions last about 30 to 70 seconds, and they come 5 to 10 minutes apart. The provider will check the woman's cervix to check how many centimeters dilated she is, and the fetus will move to the anterior position, which means that the baby head is down and the pelvis facing the woman's back. False labor are the contractions that happen during the final weeks of pregnancy. They are not signs of labor. They come and go with different patterns and consistency, and they are painless. This usually happens in the last 2 to 4 weeks before the due date. The woman can stop and sleep to provide comfort measures like oral hydration or emptying the bladder. The provider must check the cervix to be sure there is no significant change in dilation or effacement. The fetus remains in a posterior position, which is the facing head down, but their face is positioned towards the woman's stomach. There are stages of labor. The first stage of labor is pain that can be felt as back and leg pain, which is called internal visceral pain. This stage causes many different pain types. They are dilation, effacement, and stretching of the cervix, distension of the lower segment of the uterus, and contractions of the uterus with resultant uterine ischemia. The Latin phase is part of the first stage of labor. It's on the onset of regularly perceived uterine contractions that are mild and last 20 to 40 seconds. Active phase is also first part of the first stage of labor, and it's a stronger uterine contraction lasting about 40 to 60 seconds. Transitional phase, another part of the first stage of labor, is when the uterine contractions reach their peak, occurring every 2 to 3 minutes for 60 to 90 seconds. And during the second stage of labor, the somatic pain that occurs with fetal distinct and expulsion. This stage causes pain types such as pressure and distension of the vagina and the perineum, described by the client as burning, splitting, and tearing. The third stage is pain with the expulsion of the placenta. And during this stage, it causes pain such as uterine contractions and pressure and pulling of pelvic structures. The final stage is the fourth stage, and the pain is caused by distension and stretching of the vagina and perineum, incurred during the second stage with a splitting, burning, and tearing sensation. Nursing care during stages of labor. The nurse should establish a therapeutic relationship with the patient to promote comfortability. And during the first stage of labor, the nurse should assess the patient's psychological readiness, measure the duration of the Latin phase, make sure the proper forms are completed, and teach the mom breastfeeding teaching if she plans on doing so. Also, you should educate them on different relaxation techniques. Inform your patient on the progress of their labor and encourage her to be active. Monitor the mom vital signs and the fetal heart rate every 2 hours. During the second stage of labor, the nurse should instruct patient on quality pushing and ensure the patient understands the doctor instructions, provide positive feedback as the patient pushes, and also assist in restrictive episiotomy for patients who have vaginal births. During the third stage of labor, the nurse should assist the patient in relaxing for delivery placenta. Encourage the mother that her and the baby should have skin-to-skin contact so they can enter the bonding phase. Ask the mother if she wants to keep the placenta, and if she do, give her the proper instructions on infection precautions. The nurse should also follow doctor's orders and administer oxytocin. The nurse should continue to check vital signs and monitor for excessive bleeding. During the fourth stage of labor, the nurse should perform nursing duties to prevent infection and hemorrhaging. Fetal monitoring. The nurse should perform external palpitations of the maternal uterus through the abdominal wall, which is called Leopold maneuver. And this determines the presenting part, the fetal lie, and the fetal attitude, and also the degree of distinct of the presenting part into the pelvis. The vertex presentation is when the fetal heart tones are monitored below the client's umbilicus in either the right or the left lower quadrant of the abdomen. The breech presentation is when the fetal heart tones are monitored above the client's umbilicus in either the right or left upper quadrant of the abdomen. During the Latin phase, the monitoring is every 30 to 60 minutes. During the active, it's every 15 to 30 minutes. And during the second stage, the monitoring is every 5 to 15 minutes. Newborn response to birth is the infant tries to adapt to life outside the womb. This often includes crying. APGAR score is done following the birth as newborns transition to life to rule out abnormalities. The nurse should collect data on the newborn, such as external data collection, chest, abdomen, neurologic, weight, length, head circumference, and chest circumference. A physical exam will be performed from head to toe. Normal respiratory rates for infants are 30 to 60 breaths. The heart rate ranges from 110 to 160. Blood pressure is 60 to 80 systolic and 40 to 50 diastolic. Normal temperature is 36.5 degrees Celsius to 37.5 degrees Celsius. And the nurse should suction the mouth of the baby first and then their nose to prevent aspiration. In conclusion, giving birth can be so beautiful, scary, life-changing, and emotional for most women. Labor can be defined as the presence of regular uterine contractions with progressive cervical dilation and effacement. Make sure that the mom follows in special instructions and when her and the baby are discharged. And it's important to take time out for themselves. Make sure they schedule a follow-up visit with their doctor, and be sure to schedule a follow-up visit if you feel that you're experiencing development of postpartum depression. Also, allow your family, spouse, friends to help, so prevent the mom from becoming overwhelmed.